Understanding hair and scalp disorders is crucial for cosmetologists. This presentation will cover the importance of this knowledge, common types of hair loss, hair disorders, and scalp disorders. We'll explore how to identify these conditions and provide appropriate treatments or referrals. Why study hair and scalp disorders? To recognize what is treatable by a cosmetologist and what should be referred to a healthcare provider. You should have a thorough understanding of hair and scalp disorders and diseases because identifying the differences between common and irregular hair loss helps better recommend client hair loss treatments. Recognizing scalp and hair conditions, as well as when a client should be turned away and referred to a physician, is part of your infection control duties. Check-in question 1. Why is it important to know the differences between common and irregular hair loss? Answer. Identifying the differences between common and irregular hair loss helps better recommend client hair loss treatments. Types of hair loss: androgenic alopecia, genetic hair loss affecting both men and women, characterized by miniaturization of hair follicles; alopecia areata, autoimmune disorder causing patchy hair loss in round or irregular shapes; postpartum alopecia, temporary hair loss experienced after pregnancy due to hormonal changes. Androgenic alopecia, genetic hair loss affecting both men and women, characterized by miniaturization of hair follicles. It can affect anyone and is caused by genetics, age, or hormonal changes. Androgenic alopecia can begin as early as the teenage years and is frequently seen by age 40. By age 50, almost 50% of men experience some degree of hair loss, National Center for Biotechnology information. Approximately 30 million women experience hair loss, commonly after menopause, U.S. National Library of Medicine. Male pattern hair loss generally involves thinning and/or baldness in a horseshoe shape. Female pattern hair loss typically appears as a generalized thinning over the crown, top of the head, and temple areas, U.S. National Library of Medicine. Alopecia areata, an autoimmune disorder causing patchy hair loss in round or irregular shapes. The immune system attacks the hair follicles, which leads to hair loss in round or irregularly shaped patches. White blood cells stop hair growth during the anagen phase, which causes hair to enter the telogen phase. 6.8 million people in the United States are affected by alopecia areata during their lifetime. The scalp appears normal in the areas of hair loss. More advanced forms of alopecia areata include alopecia totalis and alopecia universalis. Alopecia totalis is the loss of all terminal scalp hair. Alopecia universalis is the loss of terminal hair on the body and scalp. Postpartum alopecia, temporary hair loss experienced after pregnancy due to hormonal changes. Temporary hair loss after pregnancy. Most people experience temporary hair loss 1 to 5 months after delivery. A higher number of hairs enter the telogen stage, which causes hair loss. Typically, the cycles are regulated within 6 to 12 months. Hair loss treatments: minoxidil. There are 2 Food and Drug Administration, FDA, approved products in the United States that are proven to stimulate hair growth: minoxidil and finasteride. A topical medication applied to the scalp. It has been proven to stimulate hair growth and comes in 2 different strengths: 2% minoxidil, regular strength solution; 5% minoxidil, extra strength solution. Rogaine C is the most well-known minoxidil product. Finasteride, an oral prescription medication. Finasteride is more effective and convenient to take than minoxidil, but it may have negative side effects, including birth defects in a male fetus, and therefore is not prescribed for people with childbearing potential. These medications slow the rate of hair loss, and some users even experience hair growth. It may take several months of use to see results, and the benefits end when an individual stops using the products. There are also surgical options available. A hair transplant is the most common permanent hair replacement technique. This process consists of removing hair follicles from one or more areas of the head and transplanting them into the desired area. These transplanted follicles grow typically in the new location. Cosmetologists can help clients with non-medical options such as wigs, toupees, hair weavings, and hair extensions. The emotional impact of hair loss: self-esteem. Hair loss can significantly impact a person's self-image and confidence. Social anxiety. Some individuals may experience increased social anxiety or isolation. Professional support. Cosmetologists play a crucial role in providing empathetic care and solutions. About 80 million people in the United States experience hereditary hair loss. With multiple studies linking hair loss to lower self-esteem and lower confidence, you need to be aware that this is a sensitive topic that clients may be hesitant to talk about. You are in a unique position to help your clients develop a plan to address their thinning hair. Having a strong understanding of hair loss types, current products and treatments available, and what falls within a cosmetologist's scope of practice in your state will help you serve as a resource for clients. Medicine and surgical procedures are the only proven treatments for hair loss. Your role is to help clients determine if their hair loss is typical or potentially concerning and advise them on when to seek the help of a healthcare provider. Did you know? During your career, you may have clients express concerns about thinning hair or hair that doesn't seem to grow. Several internal and external factors affect hair's health, including nutrition, hormones, and styling. The body supplies nutrients to organs first, followed by muscles, bones, tissues, and lastly, hair. A well-balanced diet provides enough nutrients for the hair as well. Hair follicles take 3 months to regenerate. If you start a supplement regimen or improve your nutrition, it will take 3 to 4 months to notice hair health or growth changes. Androgens and thyroid hormones affect thinning hair as well. Androgens, including testosterone, affect the dermal papilla and production of keratinocytes, which leads to hair follicle miniaturization and affects hair growth. Insufficient thyroid hormones and metabolic disorders may also cause thinning hair. Damage from styling also hinders hair growth. Your knowledge of hair structure and what causes damage. Check-in questions. 2. What is the typical amount of hair lost per day? Answer: between 50 and 100 hairs. 3. Describe the most common types of hair loss. Answer: the most common types of hair loss are androgenic alopecia, characterized by terminal hair miniaturization and a shortened anagen phase, the result of genetics, age, and hormonal changes. Alopecia areata, an autoimmune disorder where the immune system attacks the hair, which leads to hair loss in round or irregularly shaped patches. Postpartum alopecia, temporary hair loss after pregnancy. 4. What are the only 2 FDA-approved hair loss treatments? Answer: the only 2 FDA-approved hair loss treatments are minoxidil and finasteride. Common hair disorders. Canides, the technical term for gray or white hair. Canides result from the loss of the hair's natural pigment. Other than the absence of pigment, gray hair is the same as pigmented hair. The 2 types of canides are: congenital canides are present at birth. An example of congenital canides is albinism. People with this condition are referred to as albinos and are born without pigment in the skin, hair, and eyes. Acquired canides are a result of age and genetics. As we age, the hair follicle produces less melanin, which causes gray or white hair. Extreme stress or illness can also contribute to graying hair. Ringed hair is a variety of canides characterized by alternating bands of gray and pigmented hair throughout the length of the hair strand. Hair disorders, hirsutis, and hypertrichosis. Hirsutis are the growth of terminal hair on a female's body in areas that typically do not have terminal hair, such as the upper lip, mustache area, chin and cheeks, beard area, and chest. A condition in which hair grows longer or thicker than usual. Hypertrichosis. Treatments for hypertrichosis include electrolysis, photoepilation, laser hair removal, shaving, tweezing, depilatories, epilators, threading, waxing, and sugaring. Refer to Figure 8-3. Hair disorders. Trichoptilosis, the technical term for knotted hair. It is characterized by brittleness and the formation of nodular swellings along the hair shaft. When in this state, hair breaks easily and the broken fibers spread out like a brush along the hair shaft. Hair disorders. Trichorexis nodosa. Trichorexis nodosa near the scalp is often caused by chemical straighteners or excessive thermal pressing. Damage located toward the hair strand's ends is caused by mechanical damage, such as excessive backcombing or brushing and hair aging. Treatments include softening the hair with conditioners and moisturizers. Refer to Figure 8 to 5. Hair disorders, monolithics, the technical term for beaded hair. The hair has a beaded appearance due to the narrowing of the hair shaft. The hair is brittle and breaks easily. People with monolithics also have sparse hair growth. Monolithics is caused by a gene mutation and has no recognized treatment. People with monolithics should avoid hair trauma such as coloring, bleaching, and perming. Conditioning the hair and scalp will help achieve maximum growth potential. Hair disorders, fragilitas, crinium, the technical term for brittle hair. The hairs may split or break at any part of the hair strand. Causes include excessive exposure to UV rays, mechanical and chemical abuse, pulling the hair tightly into braids or ponytails. Treatments include conditioning the hair, cutting above the split to prevent further damage. Check-in. Question 5. List 3 hair disorders. Answer. Answers may include canides, hirsutis, hypertrichosis, trichoptilosis, trichorexis nodosa, monolithics, or fragilitas crinium. Introduction to scalp disorders. Skin is in a constant state of renewal. The outer layer covering the body is shed continuously and replaced by new cells. The skin cells of a healthy scalp fall off naturally as small dry flakes without being noticed. Dandruff can easily be mistaken for a dry scalp because the symptoms of both conditions are a flaky, itchy scalp, but there are differences. Dandruff commonly produces an oily scalp. The flakes from a dry scalp are much smaller and less noticeable than the larger flakes seen with dandruff. Dry scalp can result from contact dermatitis, sunburn, or advanced age, and is usually made worse by a cold, dry climate. Dandruff, pityriasis. Pityriasis is the technical term for dandruff, which is characterized by the excessive production and shedding of skin cells. Refer to Figure 8 to 6. Dandruff is caused by a naturally occurring fungus called malassezia. Malassezia feeds on the scalp's oil. When the scalp becomes irritated, redness, itching, and dryness can be present. The body responds by producing more epidermal cells to shed the irritant. Dandruff can be affected by stress, pollution, and seasonal changes. Anti-dandruff shampoos contain the antifungal agents pyrithione zinc, selenium sulfide, or ketoconazole to control dandruff by suppressing the growth of malassezia. Anti-dandruff shampoos are available in a variety of formulas for all hair types and can be gentle enough to use every day. Regular use of an anti-dandruff shampoo is essential for controlling dandruff. Dandruff is not contagious. 2 principal types of dandruff, pityriasis capitis. Simplex dandruff is not contagious. The technical term for classic dandruff is characterized by scalp irritation, large flakes, and an itchy scalp. The scales may attach to the scalp in masses, scatter loosely in the hair, or fall to the shoulders. Regular use of anti-dandruff shampoos, conditioners, and topical lotions is the best treatment for this type of dandruff. Pityriasis steatoids. A more severe case of dandruff is characterized by an accumulation of greasy or waxy scales mixed with sebum that stick to the scalp in crusts. Infants with this condition are referred to as having cradle cap. When this condition is accompanied by redness and inflammation, it is called seborrheic dermatitis. Seborrheic dermatitis can also be found in the eyebrows or beard. When trying to determine if your client has dandruff that you should not treat, look at the color of the skin and flakes in the affected area. Seborrheic dermatitis will resemble a rash. Do not perform services on anyone who has this form of dandruff. Anti-dandruff shampoo can be recommended to a client with mild conditions, but anyone with severe conditions should be referred to a healthcare provider. Treating dandruff. 1. Identify type. Determine if it's mild dandruff or a more severe condition. 2. Use anti-dandruff shampoo contains antifungal agents like pyrithione zinc or ketoconazole. 3. Regular treatment consistent use is key for controlling dandruff. 4. Professional advice. Recommend medical consultation for severe cases. Fungal infections, tinea. Tinea is the technical term for ringworm. Symptoms include itching, scales, and sometimes painful circular lesions. Several patches may be present at one time. Tinea is caused by a fungal organism, not a parasite. Tinea infections are named for the body part or location they infect. All forms of tinea are contagious and can be easily transmitted from one person to another. Infected skin and hair, as well as unclean bathtubs, swimming pools, and personal articles are transmission sources. Practicing proper cleaning and disinfection procedures will help prevent the spread of infections. A fungal scalp infection known as ringworm of the scalp. The term ringworm is used due to the circular shape of the lesion. Tinea capitis, a fungal scalp infection, is known as ringworm of the scalp. The term ringworm is used due to the circular shape of the lesion. It is characterized by red spots at the opening of the hair follicles. The hair becomes brittle and breaks. There may be black spots in the patches where the hair has broken off. Refer to Figure 8 to 7, Tinea barbae caused by the dermatophyte fungus. It primarily affects the beard and mustache areas of the face. It is similar to Tinea capitis in appearance, and the skin may be very inflamed. Do not perform services on anyone with suspected Tinea barbae. Refer this client to a healthcare provider instead. Tinea favosa, also known as Tinea favis or honeycomb ringworm, is characterized by dry yellow crusts on the scalp called scutula. Scutula have a distinctive odor. Scars may result from Tinea favosa. Hair will not grow back in scarred areas. Refer to Figure 8.8. Do not perform services if you suspect a client has a fungal condition. Protect yourself and your clients from contagious conditions. Refer the client to a healthcare provider for treatment. Parasitic infections, scabies, a highly contagious condition caused by mites called Sarcoptes scabiei that lay eggs inside the skin. Scabies symptoms include intense itching and a rash that may have blisters and bumps that resemble acne. Scabies is spread from skin-to-skin contact. The mites cannot live longer than 24 to 48 hours without a host. Refer to Figure 8 to 9. Do not perform services on anyone with scabies. Refer the client to a physician for medical treatment. Parasitic infections, pediculosis capitis, an infestation of the hair and scalp with head lice. Refer to Figures 8 to 10 and 8:11. Head lice are parasites that feed on human blood. Head lice are transmitted primarily from head-to-head contact with an infected person. They may also be spread by contact with infested hats, combs, and brushes. Head lice can live only 24 to 48 hours without a host. Distinguish head lice from dandruff flakes by looking closely at the scalp with a magnifying glass. With head lice, you will see small nits or eggs attached to the hair. An adult louse is about the size of a sesame seed. Lice are more difficult to see on individuals with dark hair. They move by crawling and can't jump or fly. Never perform a service on someone with head lice. Over-the-counter treatments are available. The directions must be followed to effectively kill the lice and eggs. Bacterial infections. Overview. Bacterial infections of the scalp may be caused by either streptococcus or staphylococcus bacteria. The most common types of staphylococcus infections are furuncles, carbuncles, and folliculitis. Bacterial infections. Furuncle definition. A furuncle or boil is an infection of the tissue surrounding a hair follicle. Appearance painful, circular lesion that may contain pus. Usually caused by Staphylococcus bacteria. Professional response. Do not provide services until completely healed. The technical term for a boil. It is an infection of the tissue surrounding a hair follicle. Refer to Figures 8 to 12 and 8 to 13. Do not provide services to the boil area until it has completely healed. Carbuncles, boils that form in a cluster. They are caused by Staphylococcus and extend into the subcutaneous tissue. Do not provide services until the affected area is completely healed. Folliculitis, inflammation or infection of the hair follicles. It presents as small red bumps or white-headed pimples around one or more follicles. Mild folliculitis may heal by itself in a few days, but more severe cases need medical attention. Folliculitis barbae, also known as pseudofolliculitis barbae, is a common type of folliculitis. It is an inflammation of hair follicles caused by ingrown hairs and can occur anywhere the hair is shaved or tweezed. Do not perform hair services on anyone with active folliculitis or folliculitis barbae. Do not perform services on anyone with a boil, carbuncle, or folliculitis. Refer the client to a healthcare provider for medical treatment. Properly practicing state board-approved cleaning and disinfection procedures will help prevent the spread of these infections. Check-in questions. 6. Name the 2 main dandruff types. Can either one be treated in the salon? Answer. The 2 main types of dandruff are pityriasis capitis simplex. This type of dandruff can be treated in a salon with the use of mild or medicated shampoos, scalp treatments, regular scalp massage, and medicated scalp ointments. Pityriasis steatoides. A client with this type of dandruff must be referred to a healthcare provider. 7. Which hair and scalp disorders cannot be treated in the salon? Answer. The types of hair and scalp disorders that cannot be treated in the salon are pityriasis steatoides, tinea, tinea capitis, tinea favosa, scabies, pediculosis capitis, carbuncles, furuncles, and folliculitis. Professional responsibilities. 1. Identify, recognize signs of hair and scalp disorders. 2. Educate, inform clients about their condition and treatment options. 3. Refer direct clients to healthcare providers when necessary. 4. Practice proper sanitation to avoid spreading infections. 1. Knowledge is power. Understanding hair and scalp disorders is crucial for providing excellent client care. 2. Recognize and refer. Know when to treat in salon and when to refer to a healthcare provider. 3. Empathy matters. Be sensitive to the emotional impact of hair loss and scalp conditions. 4. Stay updated, continuously educate yourself on new treatments and best practices. Review questions 5100 daily hair loss. Normal range of hairs shed per day. 2 FDA-approved treatments. Number of FDA-approved hair loss treatments. Minoxidil and finasteride. Hair loss statistics. 80 million approximate number of people in the U.S. experiencing hereditary hair loss. How well do you remember these key facts about hair and scalp disorders? Next steps. 1. Practice identification. Use images to improve your ability to recognize different disorders. 2. Role-play consultations. Practice discussing sensitive topics with empathy. 3. Stay informed. Keep up with the latest research and treatments in trichology. 4. Apply knowledge. Incorporate what you've learned into your client consultations. Summary and review. Understanding hair loss and hair and scalp disorders is an integral part of your profession. Knowing if you can or cannot work on someone is very important. Being able to professionally handle sensitive and emotional topics such as hair loss and a potentially embarrassing disorder is imperative for your success.